Última parte, Jornal da Noite Canadá. Falamos do sistema de Digital Quarantine Group. Foi criado por causa de Taiwan, que se tornou praticamente o único país do mundo a evitar um surto de COVID-19. O trabalho deste grupo, o Digital Quarantine, começou em meados de 2020, quando foi iniciado um diálogo com o McKay Memorial Hospital em Taipei. Aí desenvolveram um sistema que funcionasse em Ontário. Identificaram desde logo um problema crítico: a necessidade de testes conduzidos pela comunidade e também de uma plataforma que permitisse que profissionais não médicos responsáveis fizessem testes para a Covid-19 na província. Chama a vossa especial atenção para o projeto de Lazar e Alexander.
We have with us Alexander Wilson. He is a pastor with the Presbyterian Church in Canada. He currently serves as the chairman of the Community Advisor Council at the Scarborough Health Network. And Lazar Shorter, he is originally trained as a community organizer. Lazar spent several years in Asia researching public health concepts and teaching. He is hopeful that some of this knowledge can be helpful fighting COVID-19 at home. So my first question for you, how was the Digital Quarantine Working Group born?
Yeah, so to go back to the beginning, first of all, we started to think a little bit about COVID, and it wasn't going very well, particularly here in Ontario and Canada. And so we knew that in Taiwan that they had managed the pandemic really well, and we thought there's a lot to learn from them. And our natural connection with Taiwan is through Reverend George Mackay, and he had set up basically as a missionary a lot of the infrastructure that kind of has continued to bless Taiwan for generations to come, and that is around the education system and especially the hospitals. And so we had corresponded with the George Mackay Hospital in Taiwan and in Taipei, and had asked basically for some help because we need to manage this pandemic a lot better than what we have. And we don't need to go into numbers. We all know the stats. It's not been going well, and it's still very high in Ontario here. So we knew that not only did Taiwan have this excellent kind of hospital, but they had a way of managing the pandemic through digital means. So basically in Taiwan, if somebody had COVID, they had a cell phone, and they were tracked and quarantined, and the government knew if you left or not. So we thought that kind of system could be kind of modified and applied to a system here in Canada, in which there's community-led rapid testing, and that's what we think is the important part, to be able to get results instantaneously. So 15, 20 minutes. So there's a company in Taiwan that we've been working with, and they have a product, and it takes about 15, 20 minutes to get a result, and then that can then go through a QRC code right on to a network system. So whether that's Ministry of Health, wherever you want it to go, it can be uploaded. And we really thought this would be beneficial to groups like faith communities, businesses, especially in Toronto, hospitality, restaurants. All those places have not been able to be open because they don't have a proper screening system. And we think rapid testing is something that the government in Ontario should invest in. So we kind of put that forward as a proposal to them. And so far kind of waiting for answers. I don't know, Lazar, if you want to add on to some of that.
I mean, there's multiple jurisdictions that are involved. At the local level, there's the medical officer of health. At the provincial level, you have the Ministry of Health. And then at the federal level, you have Health Canada. And for a system like this to work, everybody needs to work together. And we're trying to encourage MPPs, MPs, city councilors, to figure out the rules for how community-led testing should be introduced.
So, and we do think that there's clearly a lot of emphasis right now on the vaccinations, and that's really positive. That's good, but there's still going to be that need for testing because things can still spread. People can still get sick. They might not get as sick. And what about those people who choose not to be vaccinated? What are we going to do? We think that's one of the solutions, and one of the things that could encourage actually people to be vaccinated is, well, you don't want to be vaccinated to come into this congregate setting, whether it's a business, a movie theater, a faith community, that you need to have this test before you can go into that. And we think that makes a lot of sense and can actually encourage more people to get vaccinated, because who knows what percentage we're going to reach in terms of vaccination levels, and what do you do with people who choose not to, because that is obviously still a health risk for a percentage of the population.
So very well for your showing us what means your group. So what kind of people belong to your digital group?
All right. So
we have four members, right?
Yeah, we have 4 members.
Okay.
So we have Reverend Wilson and I, who I guess were the co-chair. We discuss, the priority for the group, who we should approach, what kind of policy is targeted at which level.
Mm-hmm.
And then we also have a senior medical advisor, Dr. Paul Sharkey. He's in Kitchener-Waterloo. He worked there for a long time as a surgeon. He has a very strong understanding of the pieces that are missing right now in our approach to the pandemic, so especially the testing. So he's our medical advisor. And then we also have a network security advisor, because the testing kits use data. They use like an app, and the data goes into a cloud. So we want to make sure that we have a very strong understanding that privacy is protected and that policies are developed to protect people's privacy and anonymity.
Very good. How do you train business owners and community leaders to administer COVID-19 rapid tests?
Yeah, I'm not sure if I think you saw the video of the demonstration that we had done. So I think it's a pretty straightforward of just really going to a group and doing that demonstration and laying out the list of protocols. A lot of it comes directly with the product from the company. There's very specific instructions about how to handle it, the timing and everything, and details are there. So we think it's a pretty straightforward system. And in Ontario, they've been sitting on a lot of rapid testing kits. Now they're starting to use some of them. And I think it matters in terms of the accuracy of some of them. The ones that we're looking at are much more accurate than the ones that the federal government actually purchased previously. So accuracy does matter. And then once you've had that initial rapid test, say you get, a positive result, then you want to do the PCR test. You want to make sure that, you have that second one. But it's a way of controlling it, because right now, other than locking everybody down, there doesn't seem to be anybody who's really controlling COVID-19 particularly well.
Yeah. Do you have success with these tests? Most of people search you for to make these tests.
So right now, the training that we are introducing has been in Kitchener-Waterloo. Several business owners and representatives of the business community. Kitchener-Waterloo is leading the country right now to create a system to allow the business owners to use these types of tests. So we've been working with them, but we'd like to introduce it in Toronto, especially in the Portuguese community here.
Yep. So can you explain to us how the tests are done, or the video? Yes, could explain us, but here in this moment, is it possible to show us?
All right.
You want to see right now?
Demonstration. It is possible to schedule a demonstration.
Have COVID test will travel.
Right on.
So this is the whole
We
package.
just have a package of one test in this bag.
Okay.
So we can demonstrate right now if you like.
Okay.
Yeah.
I appreciate it.
The test will take 15 minutes to wait once we
Okay.
do the test. So you might want to cut off for a minute, but we're going to start right now. Reverend Wilson is going to test me. Okay.
Okay. Okay.
So I have my phone right here.
Okay.
I'll just put it up on the screen.
Yep.
So you can see right here, there's two apps. One is
Okay.
the COVID-19 alert app from the federal government. And
Okay.
then this app is the app for the test. So we're going to open that app, start
know.
new test.
I know. It's okay.
Okay, 1 minute.
They should have gloves here. I don't have gloves. Do you have gloves?
No, John's right. Just 1 minute.
Okay. Alexander, how much do the demonstrations cost? The cost of the demonstration.
We're doing this
It's for
for free.
free.
We're not
Ah,
charging
for free.
anybody.
Nice. Very good.
Just for educational purpose. Yeah.
Good. Very good.
So one of the things that we're just, normally you'd have gloves. We don't have, I don't have sterilized gloves right now, but
Normally we would be wearing a mask. We
Yeah.
would be 6 feet apart.
yeah.
We would
Okay.
wear gloves. Okay.
Yeah.
But this is just to show you the material.
Okay.
So I'm just
We'll
thinking
just show
about,
you the material.
yeah, okay.
So the first item we have is, this is the testing strip. Okay, so we tear it open and we take out the strip. The strip has QR code on it. Okay, so
Want to open that one?
then I use my phone,
Okay.
scan the QR code. The test is ready to begin. Then just, actually, we don't have to open it.
No.
Actually, you know what? Take it out. Yeah, take it out. Yeah. So
We're just gonna open it up
we'll
and
show
see
you
it.
we'll show you the strip.
Okay.
So,
So that's a strip.
so you can see, there's the QR code is there, and then there's this little hole that is here. That's where you put the solution in. Yeah, let's see. There we
Yes.
go.
So
Okay,
there's
so
QR code
Yeah.
right there.
QR code. We put the phone. Yep.
This is where you put four drops. Oops.
Okay.
4 drops inside there from the
Mhm.
solution. Okay. And then here is where you get the test result. 1 line for positive, 2 lines for negative.
I think I have, let me just give me 1 second.
And we have already one that we used before to show you.
So there we go. Oh, this is one that's negative, so you can see there's the 1 line that's there.
So that's a
Okay.
negative test. That's right.
Yeah. So I don't know if you want to show the other.
that's one.
So here, this is the actual swab. So this is what goes up into the nasal cavity like that.
So it's not very far. It's only about 2 centimeter, right?
Ah.
Just the end of the fluff, just inside. It's not
Okay.
for in the hospital, they do all the way back, but
Yes.
this test is just for the lower nasal swab.
Okay, we'll get this part out. So then what happens here? Let me just open. Easier to open these things up. There you go. Okay. So then on here, I might as well just break it off. So what happens is you can see there's a part that breaks off here. So you just snap like that. It comes off very easily. And then
We put it inside.
this goes in here. And then you swirl it around a few times and then wait a bit and then
Close it.
close it, let it sit a bit, and then you take the dropper. So you get extract some of the liquid,
Mhm.
and then you're gonna put it into, let's see if I can do this right, into this little reservoir there.
Right there.
Okay. All right.
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 And
And then finally, when you have the result here, then you can scan it with your phone, and then you can have the result on the app.
15 minutes, right?
15 minutes.
To show the results. Oh, very good. So, for my not the last question, but can you guarantee that the tests are safe?
So these tests were developed in Taiwan.
Okay.
the Development Institute is the Taiwan National Defense Medical Center. So originally it's like a military grade design test from Taiwan, but we didn't submit the test to Health Canada for approval because the app, the question around the app and the data and the privacy, the rules are unclear right now. So we're trying to get some answers. Is this type of test to be allowed?
Very good. For my last question to your group, what role can your group play for the Portuguese community?
Well, yeah, well, I think, you know, for us, I mean, we'd love to kind of connect with some people from the Portuguese community, just to kind of have those meetings to show what this system is like and how easy it is to use, to do demonstrations with them, and to hopefully have some of their businesses show an interest and join the movement in terms of what's already happening in Kitchener, and be part of it. Because, you know, for these things to work, usually you need a large group of people who are saying, hey, to the government, to Health Canada, we want to have this product. And it takes a little bit to get their attention. So the more people, the better. So we're hoping that those in the Portuguese community, and I'm sure there's lots of different businesses that are really suffering, lots have probably closed and are on the verge of it, right? So this is really something that we provide as a hope for the Portuguese community, that they can participate in this, and that we can have things open up and businesses can move ahead in the future.
We're very hopeful that there are representatives of the Portuguese community who understand how they can use this kind of test to protect themselves and protect the people under their responsibility. We want to help educate people and raise awareness about testing. And anywhere you are in Toronto, we can come to you, we can offer you a training how to administer the test. And then we hope that you can join our movement to ask for this test to be distributed to all the businesses.
So what is your website to every people that see us to see you?
Okay. So our website is very simple. It's www.dqwgroup.org. That's us. We're the Digital Quarantine Working Group. So please, if you have any questions, send us a message, folks.
Lazar, Alexander, thank you very much for this interview. That's a pleasure for me to speak with you. Thanks. Thanks.
We know we appreciate your time.
Thank you very much. Thank you. See you.
Bye-bye.
Bye-bye.